Hi, this is Eric from Natural Health Renewal, and let's talk today about physical pain in the body. Pain is a huge problem in our country. Around 100 million adults suffer from a pain condition. That's about 1/3 of the country. And pain is the most common reason that people go to the doctor for an office visit, and one of the most common reasons that people stay home from work because they aren't feeling well enough to go in and be productive. So there are many different pharmaceutical drugs that treat these physical pains, and they can get you through a painful episode and help to relieve it. But in the long run, there are unintended consequences when you use these drugs long term. So let me give you a few examples of some of these drugs and the unintended consequences. Non-steroidal anti-inflammatories are things like ibuprofen, and these are used by many people, or they're over the counter. They can help to reduce the pain and inflammation, but if you use them long term, they can cause some bleeding in your intestinal area and also leaky gut. And leaky gut is when your small intestine starts to form little holes in it where material leaks out into the bloodstream that shouldn't be there, and it causes a lot of inflammation. So that's not something we want. Analgesics is another type of pharmaceutical drug that is often used to treat pain. And this is like Tylenol. But if you take it short term, it can help. But if you take it long term for a chronic pain condition, it can lead to liver issues. So your liver can become damaged over time, which is not advisable. A third type of pharmaceutical medication for pain is steroids. So steroids in the long run can cause hormonal changes. They can cause hormones to become out of balance. They can also cause bone loss and weight gain. The fourth category is narcotics, and these are the opioid drugs that have caused so many people to become addicted and ruin lives. And many medical doctors today are advising people to not be on these for long term because it turned out to be a mistake to prescribe these in such large amounts. It led to so many problems. Also, pharmaceutical drugs taken for pain can deplete your body of important nutrients. So for example, ibuprofen, that non-steroidal anti-inflammatory we just mentioned, if you take that for a while, it can block the absorption of folate, and folate is a nutrient that actually is good for your joints. So you may be taking ibuprofen for a joint pain, but in the long run, it's actually depleting you of a nutrient that helps to rebuild your joints and make them strong and healthy. So at Natural Health Renewal, at the clinic where I work, we use natural drug-free methods to decrease pain in your body. One of our methods is acupuncture. And acupuncture is a type of therapy that's been used for thousands of years, and it helps to decrease inflammation in the body, which is such a part of every pain condition. It also helps to improve circulation of healthy blood through your system. And when you have pain, generally that area is not receiving an adequate amount of healthy blood. And the blood carries the oxygen, blood carries nutrients, blood carries the natural painkillers that our bodies make. So if the blood is not flowing properly, the pain condition is going to persist. Also, acupuncture helps to relax the nerves so that the nerves are not so inflamed and overactive, and this helps to relax your muscles. So also at Natural Health Renewal, we offer a type of muscle testing called nutrition response testing. And this is a non-invasive way to uncover which organs and glands in your body are not functioning correctly or are under a lot of stress. And when we support those organs and glands with nutritional supplements, dietary changes, homeopathic remedies, and herbal remedies, those organs and glands become stronger and healthier. And the secret is, a lot of times people with pain conditions, like in their joints or their muscles, the real reason is because they have an organ or a gland that's not healthy, or it's under a lot of stress, and that organ or gland is affecting the muscles and the joints. So it's kind of pulling the blood and the nutrients from those joints, because the organs and glands are your number one priority. Your body is going to take care of those first. So if one of those has problems, your body will sacrifice part of your muscle or your shoulder or your knee or your lower back to help those organs and glands. So an example of this is someone who has a liver issue. They might have a lot of right shoulder pain because the liver is on the right side of the body and can affect that area. Also, someone who has a prostate problem, they have stress in their prostate, that can cause a lot of lower back pain. Also, if you have an issue with your pancreas is just not functioning as well as it should, you might have pain in your joint of your thumb because the blood vessels and nerve pathways connect the pancreas to this part of your body. So it's very common that by helping these organs and glands, your musculoskeletal pain gets a lot better. So if you'd like to learn more or set up an appointment to talk with me about any pain condition you might be experiencing, please give us a call or send us an email. I'd love to talk with you about what kind of problems you might be having with musculoskeletal pain or any other chronic health condition, and talk with you about how we can make a big difference in your health and in your life. So thanks for watching and have a great day.